space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome to the Confidence Doc podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in Houston, Texas, and I'm excited to do a solo episode today. I had recently posted in my stories a question about arm lifts, and I had such an overwhelming response. So I thought, let me focus on the different type of arm lifts that are out there. In essence, an arm lift is something done to treat the proximal or the upper part of the arm. It's often referred to as a brachioplasty. In medicine, a lot of terms come from Latin and Greek. Brachium means arm, so that's where brachioplasty is treatment of the arm. So just a little bit of knowledge, maybe it might help out in trivia night. So let's talk about the different levels of doing a brachioplasty. At the most kind of basic level is liposuction. So with liposuction, let's say you just have a little extra fat, but you've got really good skin quality. Then what you're going to do is you're going to liposuction this area. You can lipo all the way around. You can get a little more definition if you really like a contoured look. But if the goal is I just want to get rid of that little extra fat, this can be accomplished with usually 2 to 3 millimeter openings. So it's not something that's visibly noticeable. Unfortunately, not everybody's a great candidate for this because you do have to have really good elasticity in your skin and not a lot of fat, maybe minimal amounts of fat there. The next level up would then be doing liposuction, but also adding some sort of skin tightening device. They're both external and internal tightening devices. My preference is something called Renuvion. Now, this is a radio frequency plasma energy device. So after I do the liposuction to this area, I'm then going to insert the device through the liposuction holes. It superheats and actually causes coagulation, which is basically a controlled burning, right, of the connections between the lining of the muscle and the underlining of our skin and the dermis. Because it superheats these and kind of cooks them, it pulls the skin inward. And when it pulls the skin inward, it tightens. But it's not causing any sort of heat damage to the external skin at all. Now, there are external radiofrequency devices. There's a number of them on the market. Those can work really well, but in my hands, I found that the Renuvion works the best. Now, again, even with Renuvion, you still need to have a pretty good skin quality. That means you have to have pretty good elasticity. You have a lot of stretch marks, a lot of real laxity, it kind of jiggles a lot, then while we would still get improvement, we're not going to get as much improvement as most of us would want if you're going to undergo the procedure. So step 3 would be doing what we call a short scar arm lift or a axillary brachioplasty. So I'm going to roll up my sleeve here. So basically with an axillary brachioplasty, I'm pulling just right here. And so if you're not able to see video at the moment, when I say pulling, I'm pinching right near my armpit and pulling. When I do that, it does help a little bit on the upper part of my arm, but it does not really help much near around my elbow. A short scar arm lift seems like a great idea. It's a little scar, it hides well, but if I don't get much pull further away, then it's not really helping me much. We have a saying in plastic surgery that the further away you are from what you're doing and wanting to treat, the less of an effect you get. So if I'm way up at the armpit and I'm trying to get an effect near the elbow, it's probably not going to be that much. But there are some people who genetically just have that little bit of excess there, and so it can be a pretty nice option. The next option that goes up is what most people think of when they think of an arm lift. This is a standard brachioplasty. It means you're going to liposuction the whole arm, but then you're also going to remove skin from the under part of the arm. So if I put my arm up at 90 degrees and I kind of just let that skin hang, it's what hangs below my muscle. That skin is actually removed completely after it's been liposuctioned. There are a number of different techniques to do this and a number of different places to put that scar. My preference is that when your arm is down at rest, that the scar is not visible from the front or the back side. Some people like to put the scar just facing on the backside, so you as an individual may not see it, but everyone behind you sees it. So I personally don't really like scar placement there. But this is something you can talk about with your surgeon if you do have a specific preference for where the scar might be placed. There are different techniques with it. Sometimes you're going to use a drain with this technique. Sometimes you're not. The technique I use, I'm going to try to preserve as much lymphatics as possible. It is called the emulsion technique. Sounds kind of scary, but it's actually a much more controlled way of removing the tissue. And with it, I don't need to use a drain at all. On the most extreme, so the biggest incision you can expect with the arm lift is an extended arm lift. What that means is you have your arm lift scar, and then it goes down the side of your chest, and for a woman, it will go underneath your breast. For a man, it will kind of fall to where your pec kind of lines up on your chest. The purpose of this is not only to treat your arm skin excess, but also if you have that lot of laxity around your armpit and even onto the lateral part of your chest. It is a bigger incision, but bigger incision gives more dramatic results. Most people don't need this if they aren't necessarily a massive weight loss patient, but there are some people who still might benefit from it. It is still a very well-hidden scar. You can wear a tank top and it's going to hide very well. So I think they all have their place and they all differ depending on the technique. You want someone who has access to all of these different types of techniques and knowledge about them, because then they're going to be able to honestly tell you, yeah, this is the result that will give you the best result long term. There are other modalities like things like cool sculpting, right? Where you are actually causing freezing, which then will reduce the amount of fat. This can be a good technique for some people who have very little downtime, and would prefer to just come in for shorter sessions, to be able to treat their arms. But again, you still have to have pretty good skin quality, just like with liposuction alone. And you have to expect that you may need multiple treatments in order to see your results. The question a lot of people have is, why do my arms look like this in the first place? Right? So genetics, unfortunately, is a reason why most of us have certain things that we have. You do not necessarily need to be overweight to have laxity and extra fat deposition in your arms. Some people will say, yeah, my grandma, my mom, my dad, they all had that. And that can be for many places in the body. So if it's skin only, then doing a reduction that maybe reduces fat with cold sculpting and liposuction alone is not going to help you in any way. You need to actually remove the skin. For some people, the reason why they have such dramatic excess in their arms is because they gained a lot of weight at some point in their lifetime. And then if you then go ahead and lose that weight, then even though the fat and the skin may shrink somewhat, depending on the speed of that weight loss, you might notice that you don't see the shrinking occurring. This is more common when people have bariatric surgery. And now with the rise of the GLP-1 and 2 medications, things like Ozempic, Wegovy, Mounjaro, people are losing weight so fast that their body cannot catch up. That being said, that even if you do lose weight very slowly, the skin at the middle thigh and skin of the upper arm can be much thinner and sometimes just do not snap back as much as you'd hope it to be. A lot of people will say that arm lifts are horrible, the scars are terrible, why would anybody ever want to do that? And my answer to that always is, unless you live in somebody else's shoes, right? Unless you walk in the shoes, you just don't know how much an unattractive or lax arm might be causing them both physical and mental stress. I take care of a lot of massive weight loss patients, and they hide their arms because they're embarrassed by how they look. They're uncomfortable. They're hot in summer. It's just a hygiene issue sometimes. And so if you are covering your arms up and hiding them anyways, then a well-placed, well-hidden scar makes all the difference, and you're more than happy to have a surgery that makes that area look better and you feel more confident. There are a lot of things that can be done to keep the scars looking good. One is simply liposuction openings. This generally heals well on everyone, but you still can do things like using skin protectors. What that means is that you actually place, and it can be something that's silicone or plastic, within that opening so that way the devices you're using, whether that be Vaser, which is an ultrasonic type of heat, or liposuction, which is suction assisted or power liposuction, it's not vibrating directly against the skin, so you're causing less local trauma, which should lead to a much healthier and appearing scar that would fade over time. Also, in individuals who have a tendency to hyperpigment, it's less likely to hyperpigment using skin protectors. These are very inexpensive, easy devices to use, but I do think it takes a thoughtful and surgeon who thinks ahead to realize, hey, it's worth me taking that extra second to put these in to protect the skin. Other things that can be done to improve the appearance of the skin afterwards is scar care. Some people use paper tape. I used to in the past in this area, but what I really like now is these devices called bridges. Invented by a plastic surgeon, they take tension off of the skin. This is an area that you want tight, but also it's going to swell and you don't want to pull apart. The best scars have minimal tension on it. So these little stickers essentially sit on the skin. They're replaced maybe 2 or 3 times for 6 to 8 weeks. They take tension off of the scars, and I found that my scars have looked even better, no matter the ethnicity or the age of the patient, by using these. In addition, I like to use arm compression no matter which of those techniques I'm using. I will use arm compression 4 to 6 weeks. It helps reduce swelling. It also helps you kind of conform your arm, and you're encouraging that skin to tighten. Some people will also opt to do a lymphatic massage. In the case of using heat energy, so radiofrequency heat energy, no matter what the device, absolutely need to do massage. And that's not only having a professional doing it afterwards, but also self-massage to hopefully smooth out the tissue because it's getting so much energy. It often takes that little extra massage to give it smooth, nice, clean results long term. So I hope this was a good glimpse into all the options available for treating arms. Again, it doesn't always have to be a big incision. It should be tailored to what your specific needs are. And again, it is very important to go to somebody who can offer the most extreme example as well as the most minimal example so they can tailor it towards your needs. I'm hoping to do a lot more of these kind of solo sessions so that I can make sure that I really go into depth about these specific topics that my listeners are really, really interested in. So thank you so much for joining me on the Confidence Podcast Solo Edition, and I will talk with you all soon.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.